My name's Tony. I'm the coordinator for Chinese Medicine 1, which is the core theory module in Year 1. The module is divided into sections where at the very beginning we look at an introduction to the historical development of acupuncture, and also we have a look at kind of different approaches in acupuncture, different styles of acupuncture, really trying to unpack what we mean by the term acupuncture. Then the module moves into looking at core principles behind the thinking that acupuncturists use, at least traditional acupuncturists as opposed to Western trained acupuncturists or physios, people like that. And because what we're trying to do is adopt a different mindset, a module, a way of thinking that is based on a slightly different view of the world that's much more emphasizes the kind of interconnectedness of the world and the interconnectedness of symptoms and signs that patients present with. And this is one of the things that's unique about traditional Chinese medicine and traditional acupuncture. And so we need to be able to see the body in a slightly different light. So the first few lectures are really all about that. They're about to try to adopt this mindset and to familiarize ourselves with these principles. The next few lectures are looking much more at the body from a traditional Chinese perspective, specifically looking at the organs from a traditional Chinese perspective, which is a bit different really from a Western perspective, and looking at the channels and the substances, which are the kind of key ideas that we utilize in forming a diagnosis and a treatment principle. And that takes us really through most of the rest of the year to try to really get very familiar with these ideas and to be able to really explain and account for the functioning of the body from a traditional Chinese perspective. Towards the end of the year, then we start looking a little bit more about the application of Chinese medicine. So we're looking more to do with the development of illness, how illness arises, and also specifically looking at diagnosis. And this is the traditional 4 diagnostic techniques in Chinese medicine of looking, listening, smelling, asking, and palpating, touching. And when we combine these techniques, then we come across, we arrive at a diagnosis, and then the diagnosis leads to a treatment principle and then selection of points. So by the end of the year, if you can completely absorb all the information, you really got a good basis for treatment, even though you won't have the clinical experience and the confidence to be able to carry it through. But nevertheless, it's the meat and 2 veg of the whole course really.